Hello friends, myself Dr. Parthiv Shah. I am a consultant chest physician at various hospitals in Borivali, namely Ashokan Hospital and Apex Group of Hospitals. I was previously attached to Sion Hospital as an assistant professor as well as at KJ Somaya. Okay, so today we are going to talk about tuberculosis. So the first thing that comes to mind is, what is tuberculosis? Tuberculosis is an infective disease. It can infect any part of the body except for the hairs and nails. It preferably involves the lung, the spine and the lymph nodes. These are the three main organs in which the tuberculosis is mostly found, right? Why is it so important to study about the tuberculosis, or why is it so important in India? So when you look at the health data coming from 2018 report of the Global Health Status, it says that India is the leading country in the tuberculosis. We account for almost 27% of the total TB population and 27 lakhs incidence cases per year, with a mortality of around approximately 4.5 lakhs of the total TB cases and the MDR cases of approximately around 1.5 lakhs per year. This is the incidence rate, which is very high compared to any other country in the world. Okay, so coming forward, how do you get tuberculosis? So tuberculosis is usually caused by an organism, Mycobacterium tuberculosis. It is usually been spread by the humans while speaking, coughing and sneezing, which is released into air. This organism, when it's released into air, is inhaled by the another person, and patient gets the infection, and the another person gets the infection. Normally we have an tuberculosis disease and we have a tuberculosis infection. So since we are all exposed to tuberculosis organism, tuberculosis, we don't manifest, all of us don't manifest the disease. The people who manifest the disease are the people who are suffering from the tuberculosis, and rest are only the infected organisms, in whom we call it as a latent tuberculosis. Okay, what are the signs and symptoms of which you will feel like that you got the tuberculosis or you need to worry about? First and foremost, if it is involving the lungs, the patient usually has coughs for more than 2 weeks, may or may not be associated with blood in the sputum. Breathlessness may be there, fever, unintentional weight loss, night sweats. These are few of the symptoms which are associated with the tuberculosis. If any particular organ is involved, the tuberculosis may manifest in that particular organ depending upon the size and the severity. It can also involve, the severe forms of tuberculosis may involve brain, heart, kidney and adrenal glands. How do you diagnose the tuberculosis? So the first most important thing which the doctors usually do is they do the routine blood test. If the patient is coughing, the most important diagnostic modality is the sputum investigation, which we check for the tuberculosis bacilli, a chest x-ray. These are the three most important things. Montu test as well as the IGRA may add to the diagnosis. However, it is not specific, neither sensitive. In rare cases in which the patient is not able to produce the sputum, or if the patient is having blood in the sputum, there is another test in which we can identify the tuberculosis is through the bronchoscopy. Okay, so what is bronchoscopy? Bronchoscopy is basically a tool through which we enter into the lung. For the diagnostic modality, we take the sample cough through that flexible tube, and then we send it for that cough is sent it for the examination. That has a very good yield of approximately around 80%. Once the TB comes positive, the treatment is based on the categories which have been followed by the World Health Organization. There is category 1, category 4 and category 5. Category 1 is of 6 months, which is a drug sensitive TB, in which the drugs which we are given to the tuberculosis bacilli are all sensitive. The category 4 and category 5 are supposed to be the drug resistant TB, in which the primary drugs which are used in the tubercular medicines, the tuberculosis bacilli are resistant to it, and hence the treatment may vary from 2 to 3 years. And also, if you want to contact me follow www.lybrate.com and get your queries solved.